And good afternoon. I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. We're broadcasting and streaming live spine surgery. Our patient is here for back pain. We're going to fix his back pain by repairing 3 discs in his back. He also has leg pain, leg weakness, leg numbness. We call that radiculopathy, and specifically leg numbness and weakness when he's standing and walking gets better when he's sitting down. That's called neurogenic claudication. It comes from spinal stenosis or pinched nerves. Those nerves get pinched harder when you're up walking around. That's because when you're up walking around or standing, your spine curves backwards more. The holes where the nerves come out get narrower, so the nerves get pinched harder. Right side is 3, 4, 4, 5. Everybody agrees? We're on the right side. So we're going to be fixing 3, 4, 4, 5, 5, 1. We're going to go ahead and get started. If you have questions, ask them. You can type them up, and I will do my best to answer them for you. We've already given some numbing medicine. Now we're going to take a look, navigate down. All right, that looks pretty good. I could probably be a little bit lower. And let's put some num-num. Lay still.
Doing great.
Yes, yes, we know. We're just giving you some medicine. Come on, Berndes. Yes, we know it hurts. Just relax. Okay? You're awake. We need you awake. Just relax. You're doing great. Shot. All right, so we're going to aim for 4, 5. Shot. You're doing great. Lay still. Don't talk too much. You're doing fantastic. Everything's okay. Uh-huh. All right, so people wonder, why is the patient awake? We need the patient awake in the beginning for the first few minutes. Shot. But we need them not too wound up. We'll try to get him a little bit more comfortable. Shot. All right, so while we're getting access to fix 3 discs, would you show the audience, Henry, why do these discs cause pain? But actually, before you do that, show us the 30 different things that cause back pain.
Of course.
I'm Dr. R. Duke Machen with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. And welcome back. You've now seen that there are 30 things that commonly cause back pain. Those things are mostly joints, including the facet joints or the disc, and in his case, the disc. Not only is he having pain in his back, but he's also having symptoms of a pinched nerve going down his legs. And this bottom disc is super collapsed. Really collapsed down and full of arthritis. So I'm trying to get in on the left side, and let's see where we are. Give me an AP again. May have to wait for him to go to sleep before we get in there. Any questions from our audience?
At this moment, no current questions.
All right. Jordan, go back, please. So we are in really good position with the needles. I'm very happy. Give me a shot. Fix that. You're not in the center there. You see 5 spinous process is off to the side, my side. I think you have to go the other way. More. There we go. Better. All right, that's much better. Very good. You can see, show us the needles, Jordan. We have a needle tip sitting in the herniation at 3, 4, and then right at the back of the disc at L3-S1. So that bottom needle, I'm not quite in the disc, but I'm sitting right in the back, and I feel a lot of arthritis blocking the needle from going in. So I'm going to try to finesse it into the disc right through the tear. Huh? How close is he? Shot?
How you doing, my friend? You okay?
Yeah, we're right at the back of that. You see that? That's impressive.
Questions, all right? Open your eyes.
So I may have to wait till he's asleep to get in. I've just made a little bit. I just got oh, there we go. We got in. Yes. Damn. Thanks to our anesthesiologist. He relaxed him. We're good. All right. This is great news. We're in all 3 discs. How close is he?
I don't know. I might need a
Take your time.
Hey, open your eyes for me. How you doing? Good, okay. Don't move.
Perfect. L3-S1 has got a big herniation on the left. L4-5 on the right. How are we doing, Henry?
Doing good. Doing very, very good.
We're back.
Yeah, we're back.
Any questions?
At this moment, no current questions. So
What?
I know, right?
Our
We had
audience-
such a field day with the.
Our audience is slacking. I'm not happy about it. All right, so these things, for those watching, are herniations. How long has he had pain?
6 years.
All right, so he has herniations, 3 of them. So he's from Canada. I'm going to draw the Canadian flag since we have some time. Isn't it like a maple?
Yes.
How many how many of those little prongs does it have? The Canadian flag. He's Canadian. Canadian. All right, we're going to get the whole operating room to sing "Oh Canada." Yes? No? Don't we have...
Friend, you okay? Open your eyes for me, okay? We're gonna ask you some questions. Open your eyes.
Can you sing for us?
Open your eyes, all right? Water. Good. Say his name.
All right. Can you hear me? Yes, no, maybe so?
Yeah, he's away.
Are you having any pain?
Are you having any pain right now? Any back pain? My friend, any back pain right now? Can you open your eyes?
Hey,
Okay. No back
see if
pain.
you can
You
get
sit down.
Duke Spine Institute.
Okay.
See,
Yeah.
customized, cost. All right.
He said no pain.
Is he reliable?
Said no pain. Can you open your eyes for me?
Any questions?
Good. Open your eyes
Yes,
for me.
we have a question coming from Pawn Lust on YouTube.
All right, I'll take it in a moment. We're gonna
Not a problem.
We're going to do our discogram.
Copy that.
All right, you comfortable? How bad is that on a scale of 1 to 10? How much pain?
Give us a number. 10.
All right, 10. Is that where you get your back pain? L4-5 is a 10, guys. 10, and that's where he gets his back pain. Did you see his back arch up? You're good. All done. How bad is that on a scale of 1 to 10? 17. All right, good. We're going to be done in a moment. We're going to put you back to sleep. When you wake up, that will be gone forever. We're almost finished. I'm so sorry. How bad is that one? How much?
What do you say? 9? 10.
10. Okay, my friend, that will be gone when you wake up. Congratulations, we found 3 bad discs. Don't move. Go to sleep. I want you to count from 1 to 100 in Canadian.
Don't move. Don't move.
Lay still. Just count from 1 to 100 in Canadian. I think his wife is hopefully going to get a crack out of that one. Don't move. All right, take your time, Dr. B. Let's put him to sleep, and then we'll get started. Folks, great news. We just tested the 3 discs we're fixing. He had 17 out of 10 pain at 3-4, 10 out of 10 at 4-5, 10 out of 10 at 5-1. Very painful. He's not happy right now. Lay still. No, you don't have to. You lay still. Dr. B, what can we do to help this gentleman get more comfortable?
Stay still, okay? Stay still. Sir, stay still. Don't move. Patience. Okay, my friend, you're doing great. Just don't move. I don't have an on and off switch. I can't do this, especially with him.
Come on, Berndes, don't give me that.
Okay. On, off.
No.
Hey,
It's called
don't move.
not drawing up the meds now, we're drawing them up 5 minutes ago. Having them ready. Anticipation. All right. Take the question, Henry.
Yes, sir. Coming from Pawn Lust on YouTube, asking, is your technique also able to access and remove unconvertible osteophytes affecting nerve roots in the cervical spine?
Yes, we can remove osteophytes on the uncovertebral joints, but that's almost never necessary. Seems to be better. You want me to wait or keep going? All right. We are making our way down to the L4-5 herniation. You can see the tip of the dilator. Jordan, that's you. And it's approaching the tear. Where's the tear? Right there. Nope, the back of the tear. The door, yes. Shot? All right, we are right at the tear, right at the herniation. I'm going to move this right through into the disc. Well, not into the disc, but into the tear. Shot? Yep, he doesn't like that. That is a big tear. Okay, we're in. We're good, we're in, Berndes. All right. Shot? Let's go ahead and show the audience why did this cause so much pain in some patients?
Of course.
What's the mechanism?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Our patient is sleeping comfortably thanks to Dr. Berndes' magic potions. And we are right inside the painful tear of his disc at L4-5. We are using the laser to remove the painful material causing all of his back pain. Now, we received input from the patient that these discs are causing his pain. When we tested them with the dye, he said, we said, how bad is it? The top disc was 17 out of 10. You're only allowed to go up to 10, but he went to 17. That's how bad it was. He almost came off the operating table. He was squirming around so much, it hurt so bad. So we verified that these 3 discs are causing his pain, and now we're fixing them. Now I got to tell you something. His biggest problem isn't even back pain. Obviously, he's got back pain. But his biggest problem and complaint was his legs, and we're going to fix both. So some people like him live for years and years and years with back pain, thinking that, number one, there's no way to fix it because that's what the doctors tell them and that's what their people around them tell them, and there's no way to fix back pain. So people believe now that back pain is not curable. What is a cure? A cure means you go in and treat it and the symptom, it goes away permanently, whatever it is. Cancer, if you cure cancer, that means the cancer's gone permanently, okay? If you cure memory problems, your memory problems are gone permanently the rest of your life. So a cure means you are eliminating something that is bad, like a disease. You're getting rid of it permanently. That's what a cure is. And these people believe back pain and neck pain cannot be cured. That's what the world believes. That's what we're trying to change at Duke Spine Institute. We can now cure back and neck pain at Duke Spine Institute. That's why we want people coming here to get cured. So he came with the belief that back pain is not really curable or the problem, but he wanted his leg issues fixed. Turns out he's got bad back pain too. We didn't know that until we did his discogram. So he's just been accommodating his back. He's basically changed the way he stands and walks to not make his back hurt. But his back has been hurting, and it's been hurting very badly, obviously. That's what we discovered in the operating room. And the patient almost came off the table when we tested those discs for back pain. So yes, his discs are hurting, his has back pain, but he also has leg symptoms. We're going to fix both. All right, any questions from our audience?
No current questions, so we do have a comment coming from Mike Jones on YouTube saying, "This is incredible. We're back."
Yes.
And we just got a question from Lanu on YouTube.
All right, Lanu, nice to have you back.
This is, I think this is a comment and or question. Either way, they said, medical industry doesn't want cure for cancer or else they will lose all future profits.
You are correct, Lanu, but it's not just cancer, it's also back pain. You know, the money made in treating back pain in America is 100 times more than the money made treating cancer. So if you think the industry doesn't want to cure cancer, back pain is even a bigger problem. The industry does not want to cure back pain. We do at Duke Spine. We have the cures. The industry has tried to keep our cures away from you so you don't know about it. They've tried to hide our findings and our research and the results and our treatments. They've tried to bury our success so that you don't know about it. You, the public, you, the sufferers. They want you to do what they want you to do, which is to make them money. They want to put stimulators in you. They want to treat you with epidural steroid injections. They want to put metal in your spine and plastic in your spine, stem cells in your spine. The industry is only interested in one thing, profiting off of your suffering. Duke Spine Institute is not interested in profiting off your suffering. We want to cure your suffering. So we're different than everyone else. You're not going to find too many places in the world that are like us. I don't believe in making people suffer for profit. It's wrong. It's immoral. And as long as I maintain control of this company, I will make sure that people can come here to be fixed, not to be prolonged for suffering. All right, we're just about done with our first disc. You can see the tear. You can see the fat in the epidural space right there. Okay? We're at the back of the tear now. We've cleaned out most of the herniation that was stuck in the tear. The laser, for reference, is 1 millimeter. 1 millimeter. That is the glass fiber. It is a fiber optic fiber. Okay, he's moving a little bit. So this is the most painful part of his disc that I'm debriding right now. That's why he's feeling it right now. But that's okay. We like patients to breathe and do what they're supposed to do. He's still comfortable. We've given him plenty of medicine for pain. He's a big guy. He's like a big Canadian polar bear. Hey, lay still. Can't come off this table. All right. What do you think, Dr. B? He's a fast metabolizer, huh? All right, I'm just going to wait a minute. Is he just gobbling up medicine?
Yes. So I can't keep the syringes filled back.
Any questions?
Yes, we just got a question from Smarzig on YouTube.
Smarzig, I love that name.
Yeah,
It's a really cool name. All right, let's go with the grabber.
they
Hold
asked,
the patient.
have you had success working with BCBS insurance?
Blue Cross Blue Shield. As a matter of fact, we have had some Blue Cross Blue Shield success, but very limited. The patients that have had this surgery have paid deposit out of pocket before their surgery. We bill Blue Cross, and if Blue Cross does not pay for some reason, which they try to get out of paying all the time, for anything, as a matter of fact, then this group of patients is actually going to sue Blue Cross to get them to pay. So we've had limited success from Blue Cross. I would say 5%, if I had to guess, of the claims are paid full. The other 95%, they do not pay properly. They underpay or deny. Very common for insurance companies to do. Let me know when I can proceed, B. Yeah. Insurance companies do not want to pay for your back care. They don't want to pay. So what they do is they'll pay for treatments that don't work, and they know that you're going to find out those treatments don't work. And then you won't get them. That way they don't have to say no, you say no. But for treatments that work, they don't want to pay for treatments that work, because more people will want them.
We have another question
Yes.
coming from Pawn Lust once more on YouTube, asking, do you have a favorite PPO to work with?
Do I have a favorite PPO to work with? Not really. Unfortunately, Pawn Lust. I wish there was an honest insurance company that wants to help people. You see, an insurance company is supposed to do one thing: cover medical costs for people that need it. Okay? And unfortunately, the insurance companies today, they don't want to pay for people's medical care. They just want to take your money every month, premium, and keep it. And the only way they can keep your money is if they deny payment for your services. They have to deny your treatments, okay? So that's what they do. They deny the payment, they deny the treatment, but more importantly, they're denying your care in ways you don't even know. One of those ways is their networks of doctors. They have what are called in-network doctors, and those in-network doctors do what they want them to do, or they kick them out of the network. Okay? If you start ordering too many tests on a patient to help them, or you order treatments for the patient that are expensive, they will kick you out of their network. And that is not right. Insurance companies should not be doing that to doctors or hospitals, putting doctors and hospitals out of business that they don't want to do business with because they're taking care of patients and doing what's right. So insurance companies are the most evil businesses on earth. Satan, compared to the insurance company, is a nice guy. Beelzebub, Lucifer, the devil, is literally a cheerleader compared to insurance companies, health insurance companies. Insurance companies kill you in ways you don't even understand, which is why that guy, Luigi, got so angry, he went after the CEO of United Healthcare and killed him. Okay, I don't condone murder, ever. I think it's horrible. Any kind of murder, whether it's war, whether it's, revenge murder, it doesn't matter. It's wrong. Taking a human life or any life, even an animal, small animal, is bad. So I'm against it, but it just highlights the fact that people are getting sick and tired of what the insurance companies are doing to destroy their lives. And these insurance companies are destroying lives. There's no doubt about it. And unfortunately, nobody is stopping them. The president won't stop them. The vice president won't stop them. Elon Musk won't stop them. Vivek Ramaswamy won't stop them. They're too powerful for anybody. If Trump wants to prove his masculinity and his virility and his ability, then he needs to fix our health insurance system. And I can help him do it, but he will never do that because they are more powerful than anything else in the world. More powerful than the country, more powerful than our government, because they control our lawmakers and our government through money and influence. And these insurance companies basically write the laws that give them the ability to not pay for your care. Hold on. You understand what I'm saying? If they can write laws, this disc is under a lot of pressure. It is, look at this. It's literally pushing the dilator back out. I'm pushing it in, shot. Look at the dilator in. Is that it? Okay, and watch, I take my finger off, I'm putting about 10 pounds of pressure. If I take my finger off, it comes out. Take an x-ray, look at that. That's unbelievable. This thing is under massive pressure. That's because there's so much inflammation happening right now inside this disc. You see that? I mean, it's literally pushing this thing out like a bullet. Shot? Unbelievable. The point I'm trying to make, you people will finally understand this someday, when you're all dying of diseases that are totally curable. The insurance companies don't want to pay for your care because anytime they say no, they get to keep that money as profit. That's another mega yacht. That's another, I don't know what you even do with that kind of money. They have trillions of dollars in profits every year in America alone from denying people's treatments. What do you do with that kind of money as a person? And it's not even a company that's getting the money. There's a few very entitled people. You don't even know who they are. They control overseas accounts where all this insurance money is funneled to overseas accounts outside the United States where the United States cannot see what's happening with that money. And it's literally trillions of dollars a year. We spend $3 trillion a year in America on health insurance. And we only pay doctors and hospitals a fraction of that. So where's the rest of that money going? Well, the insurance companies say it's administrative costs, costs of doing business. Bullshit. They have computers that run everything. They have very few people. Their costs are very low. They're basically stealing your money and taking it to offshore accounts and doing something with it. I don't know, funding terrorism or something, who knows? So, do I have a favorite PPO? No, I don't. I don't. My favorite PPO is PP is power to the people. That's my favorite PPO. People power.
We have a couple more questions.
Sorry I don't have a better answer for you, but somebody needs to tell you all the truth. Stop lying to you people. You people need to know the truth so you can someday understand why your family and friends are dying. It's not because of doctors, it's because of insurance companies. Yep, I'll take it.
Next question coming from Lanu on YouTube asking, any success dealing with Kaiser Permanent Insurance?
Nope. Kaiser Permanente is an HMO plan. They're just like every other insurance. They have a closed network. They're very rich. They're one of the most powerful and richest insurance company hospital systems in the world. They're so rich they build hospitals in other countries. They spend billions and billions of dollars a year to capture more of the health insurance market. They control their doctors. They basically punish the surgeons for recommending treatments that will cure the patients because they cost the insurance company money. Okay, I have surgeons I know who used to work for Kaiser, and they told me how it works. Doctors are rewarded for recommending conservative treatment. Doctors are punished for recommending tests. They count how many tests you order per patient every year, and if you're ordering too many tests, too many tests, by the way, is too many tests for them. Then they fire you. Okay, they kick you out. Maybe even they drum up some bullshit complaint, like, oh, you came to work late too many times, when the real reason is that you're trying to help the patients get better. There's not a single insurance company out there that I trust. Now, I will tell you, there is one. It's called Workers' Comp. Believe it or not, the insurance carrier that everybody talks about as being horrible is actually one of the best. They cover this surgery all the time. And here's why. It's really interesting. You see, if you have Blue Cross Blue Shield or Kaiser this year, next year you may have a different insurance, right? You may have United Healthcare. So if Blue Cross Blue Shield gets a request to cover your back surgery this year, 2025, and they deny it, then they know next year you may not be working for the same employer, and you may have different insurance. You may have United Healthcare. And then your back problem becomes United Healthcare's problem, not Blue Cross's problem anymore. So Blue Cross just denies it, and then you say, this sucks, I'm going to go find different insurance, I'm going to go find another job. You go take another job, you get United Healthcare, and they deny it too. So people get ping pong back and forth to different jobs looking for better insurance to cover their problem. In the reality, these insurance are colluding together and agreeing not to cover these kind of conditions like back pain so that they don't have to pay. So that basically you feel like, oh, if Blue Cross didn't cover it, United didn't cover it, I guess nobody covers it. It's not fixable. I mean, the kind of games they play with people, that's why I say they're worse than Satan. Satan is a cheerleader compared to the insurance companies. Luis, would you agree? By the way, you see all that pink stuff? That was inflammatory tissue right there. That's where his pain is coming from, right there. That is the herniation, full of inflammatory tissue. What a beautiful shot, huh, Henry?
Yes, sir.
So what has to happen, folks? You have to get the President of the United States, Trump, his people, cabinet, to change the law and take away the insurance company's ability to say no to treatment. They must pay. They must be required by law to pay for the care that you need. Okay? So if you come and get Duke laser disc repair, they have to pay for it. And not just $5 for surgery that costs $100,000. They need to pay, if they're not going to contract, then they should be paying at least 50 or 60% of the bill. All right? Not 1%, which is what Blue Cross does. If you are out of network with Blue Cross right now, and I do surgery, I used to do fusion surgery on Blue Cross patients here. We have out of network. They would not contract with our surgery center. They refuse. They don't want more providers. They want less. They want you to have fewer doctors and hospitals to go to. So they wouldn't contract with the surgery center. We would do $200,000 surgery fusion, and they would pay literally $1,000. And they say, sue us if you want more, but you're going to lose. And we would lose because they wrote the laws that protect them and allow them to pay $1,000 for $250,000 back surgery. That is crazy. Then who has to pay that bill? The patient. Okay, no patient has $250,000 for back surgery. So then Blue Cross says, look, your surgery center can contract, but we're going to pay you not $1,000, but $2,000 for a $250,000 surgery, $2,000. So if you contract, you don't get paid properly. If you don't contract, you don't get paid properly. So basically it creates a situation where the insurance company wins and the patients lose. And this should not be allowed by law. It should not be allowed by law. Okay, it's allowed now, and that's why it's such a racket, and they're stealing all of your money and not giving people the health they need. Okay, that's why America is sick. That's why our country is ranked number 32 out of 32 for developed countries. We are the last because the insurance companies don't pay for anything they don't want to pay for, and that's pretty much everything. And it's getting worse, by the way.
We have a couple more questions.
Sure.
Next one from Smarzik once more on YouTube asking, are you encouraged at all by the Make America Great Again movement, and would you join the RFK Jr. panel if invited?
I would absolutely do whatever I can to help improve people's access to care. And so yes, I would definitely join whatever panel, but I'm not going to waste my time giving advice to a bunch of people who don't want it. You understand what I'm saying? So you see, here's the thing. I am not owned or controlled by the insurance companies at all. Period. I have one loyalty in my entire life, and that is, well, to my wife and my kids, God, but also my patients. Anybody with back pain and neck pain. That's who I owe my loyalty to. That's who I fight for every day. People suffering in pain, okay? That's who I care about. So if I join a panel and these guys and gals on the panel, they don't make changes that will help patients get fixed, then I'm not going to waste my time on that panel. You understand what I'm saying? So yes, I will definitely join a panel. I'll give my insight and help, but I'm not going to just spin my wheels. I have more important things to do than to waste my time advising people that don't want to listen. Okay, now I know that sounds, well, self-righteous, but the truth is I've been on those committees many years. I'm 54 years old. I've sat on political committees. By the way, look at all that inflammatory tissue right there. All the pink stuff. That's all pain area. That's causing his pain. That's why this disc is so damn painful. I don't want to sit on, I've sat on committees over the years from when I was literally 12. I've been on committees where literally the people on the committee will fight back and forth for things that they want for themselves. That's what politics really is. They're selfish people, politicians, who are just trying to make a buck for themselves. And, you know, whether they get the money directly or they get something of value in exchange for, you know, some type of public program. I don't want to deal with those kind of people. I won't work with those kind of people. I refuse to work with those kind of people. I want to work with people who will bring about the right changes and use the information I give them to make changes that help people get better access to health care. That's it. And I know how to do it, but I would definitely try, okay? I would try to sit on that committee, work with those people, and bring about meaningful change. But I'm not gonna sit on the committee just to be on a committee and not be able to make improvements in people's lives. Does that make sense? I'm improving people's lives right now working in this operating room on this person's back. That's improvement. Yes, it's one person and only one person, but I'm also improving his wife's quality of life and his children's quality of life are going to be improved. So, and his co-workers. So when you think about it, I'm fixing one man's back right now, but I'm improving the quality of life for more people around him that work with him, that live with him, that rely on him. So I'm doing a lot of good right now. My team is doing a lot of good, helping this man get better so that he can go out and help other people get better. Does that make sense? So why would I leave this, give this up, just to go sit on a committee that does nothing to help people? I'm not going to. I'm not going to do that. So I will go, I'll try it if they invite me, but if they blow me off like so many other people do, then I'm not going to stay there. I'm not going to keep wasting my time with them. I'm just going to keep coming back to the public and making you guys aware of the problem, and maybe one of you guys can fix the problem. All right, we're almost done. You guys see that tear? That was full of herniation. I cleaned it out. We're almost done. We got one more disc to do, L3-S1. Dr. Berndes has really gotten this patient under total control. He's sleeping like a baby. I don't know how you did it, Dr. Berndes, but my kudos to you.
We have a couple more questions.
Sure. Have we run the animation on how does a disc cause pain and how we fix it?
Yes, for
All
both
right.
of those, correct.
All right. Well, let's do the questions, and then maybe we can show piriformis syndrome.
Yeah, not a problem. This next question actually is similar to that, coming from Pawnlust once more on YouTube, asking, I saw research on epidural steroids versus PRP, and PRP had similar medium-term success rates without the cartilage and bone downside. I wonder why it's not supported by insurance. Epidurals aren't even FDA approved, but very common.
Yeah, it's a great question. So I think to answer your question, which is a great question, so the question is, hey doc, epidurals are paid for by insurance and covered. PRP is not. I don't understand. I saw research that shows PRP has better results than epidural. Why don't insurance companies cover it? Again, you think the insurance companies, for some reason you believe the insurance companies want to do what's right. They don't. Insurance companies want you to have access to procedures that don't work, because you'll do your research like you did, realize they don't work, and then you won't do them. That way they don't have to deny the treatment to your doctor and you. They just let you deny the treatment yourself. It's much better when the patients deny the treatment than when the insurance company denies the treatment, right? Isn't it better if you are in the kitchen and there's a jar of cookies and your mom is in the room and those cookies are just calling your name and you say, you know what, I'm going to eat healthy, I'm not going to have those cookies. It's better that you do that yourself than your mom come in and say, put those cookies down. I told you not to eat those cookies, right? So it's always better when you decide yourself to do what mom wants you to do rather than mom telling you. Now, the insurance company is not your mom. Your mom probably loves you and cares for you and wants you to have the best. The insurance companies don't give a damn about you except that you pay them every month your premium that they get, the $150, $300, whatever it is. That's all the insurance companies care about, and then not paying your claims. Okay? That's it. That's the problem. Insurance has to change for it to work in America. Yep.
Your previous patient was wondering if he's okay to go or if you want to wait to see him.
He can go.
Thank you.
All right, our last patient is chomping at the bit to go home, so I just said he can go home. Any other questions? We're just about
Yes.
done here. I got 10 seconds left. I've cleaned this entire gigantic herniation out. You can see the tear is cleaned. I'm very happy with our progress. There's no more. This is the last piece of herniation I'm seeing. The rest is pretty much gone. Just reiterate what I've said a million times before. We can never get rid of 100% of the herniation. All we can do is somewhere around 50 to 70% of the herniation. Depends on several of the anatomical things, but this patient I probably got around 70%. Grab her. But we're done. I'm going to grab this one last piece out, and then we're going to be done on the right side. We're going to go to the left side. Our patient is snoozing. There it is, that last piece. You guys see it?
Yes, we do.
That's it. So we're done here. We're going to go to the other side. And his pain will be gone when he's awake. He's going to be very happy. I feel really confident about it. By the way, look at this. The whole surgery is done through a 7mm, 1/4 inch incision. We're going to do the same thing on the left side at 5/1. Let's show the audience our piriformis release. Okay? I just
Copy
want to
that.
make a comment. Piriformis syndrome is a torn muscle in the buttock. It's called the piriformis muscle. There's one on the right, one on the left. It is the third most common cause of back pain, third. And it follows disc, facet, and then there's piriformis, and finally there's sacroiliac joint. And we have now discovered a minimally invasive way to fix piriformis syndrome. You're going to watch the video right now so you understand.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from our video that the muscle, called the piriformis muscle, third most common cause of chronic back pain, gets torn and then it never stops hurting until you basically go in and cut it. And when you're cutting it, you're relaxing the muscle. You're getting the pressure off the sciatic nerve often with that cut. Hold on. Shot. Okay, good. Shot. Uh-huh. Alrighty then. Any questions?
Yes, we have a couple more questions. The next one's coming from Royal ViewTube on YouTube.
Before I take it, I just want to say this disc on the left, 5-1, is the most collapsed and hardest disc to get to. It was not easy. We've gotten here. Shot. All right, we're in. Go ahead and get it out. Go ahead, I'll take the question.
Next question from Royal ViewTube on YouTube asking, Doc, what causes vertebrae T4 to T5 to move forward? I feel like something has been compressed. Every week I have to go to my chiropractor to align my T4, T5, and I feel immediate relief right away.
It's most likely your facet joint or your disc. Unfortunately, your chiropractor will never fix your problem. Thank you, Luis. Good job. You need to come to Duke Spine Institute and let me fix it. I can give you permanent relief at Duke Spine. Just do our free MRI review. Let me examine you on Zoom and give you a diagnosis. All right, last one. This is our 5-1. And this one was pinching the nerve. Where do you see it? Was pinching his nerve on the left side. The other two were pinching the nerve on the right side. So we're going to get this done. Remember, he's from Canada and he's going home tomorrow, back to Canada. He's going to spend the night in a hotel, but he'll spend about an hour recovering here and then basically be discharged. All right, we'll take the question.
This next question coming from Todd on YouTube
Yes, Todd?
asking, after the DLDR procedure, what symptoms during recovery will help identify surgery success? Basically, how to differentiate non-success from the nerve regeneration progression over 12 months with 1.4 millimeter per day. Should the patient just wait over 12 plus months to determine success?
It's a great question. Thank you for asking. So, success for the procedure. Number one, we are treating two things. You got to understand that. One is back pain. Number two is nerve symptoms that go down your leg. So when it comes to back pain, the back pain is typically gone the next day when patients come back within 24 hours. 90% of our patients, discogenic back pain, that's back pain that from the disc we operated on, is gone. And the success rate is 99.6%. That's the average, 99.6. That's 100%. So disc pain, success, elimination is the patient says that disc pain is gone, okay? As far as leg symptom success, yes, when you have a nerve damage from a pinched nerve, from a herniation or stenosis caused by a herniation, it doesn't always go away overnight, and patients still have residual weakness, numbness, typically the next day or even for a few months. It could take up to a year. But leg pain should be gone immediately, the next day. So discogenic back pain, gone the next day. Leg pain, sciatica, gone the next day. Weakness and numbness can take up to a year to go away. So how do you judge? If you're still having leg pain, then you have something else happening. If you had the Duke laser disc repair, then and you still have leg pain, it's not from the surgery not working, it's because you had another cause of your leg pain. Typically the piriformis muscle would be the reason, or another disc that was not treated. So I don't know if if you're talking about Duke laser disc repair, but if you have the Duke laser disc repair, the leg pain is gone immediately the next day, and the back pain from the disc is gone immediately. Numbness and weakness take up to a year to go away. So that's how you can judge your progress of symptoms. If patients still have back pain after surgery, then it's not coming from the disc. It's coming from something else. And my job is to figure out what that something else is. About 20% of our patients, I need 3 minutes. 20% of our patients will have back pain after surgery, but it comes from a different source. A source that either we identified and the patient chose not to have surgery there because they were trying to save money or whatever, or because we didn't know about that other cause of back pain ahead of time and it just raised its ugly head after the surgery. I've seen both happen, and the last option is that the patient re-herniated their disc doing something they shouldn't have done. Now that is not common. It's rare. It happens 1% of the time. Watch out. It almost hit that. It happens 1% of the time with our surgery. We get a reherniation from the patient doing something they probably shouldn't have done. That's most of the time. Sometimes they just wake up in the morning and they have a reherniation. They don't have any explanation as to why. Neither do I, except they must have done something in bed at night, twisting or turning. Maybe they fell coming out of bed, going to the bathroom. I don't know. But in the end, we don't know, but they just have a reherniation. So 1% of these patients will have a reherniation. That's our data. That's our numbers. It's not a perfect surgery, but it's an almost perfect surgery.
We have a couple more questions.
I'll take them.
Next one coming from Lanu once more on YouTube, asking, since most insurance refuse to pay, there are some wealthy patients pay with cash. Do you get suspicious?
Do I what?
Since most insurances refuse to pay, there are some wealthy patients that pay with cash. Do you get suspicious, I think in context, suspicious of that, patients paying with cash?
Oh, no. So let me correct you. First of all, yes, you are correct. Most insurances don't pay. That is a factual statement. It is true. But we don't have wealthy patients that pay for the surgery. We have just regular average people. We have poor people that pay for the surgery. They take out a loan because they realize this is the best treatment in the world for their problem to get rid of their symptoms. And they pay even though they're not wealthy. I don't know what you mean by wealthy, but we had janitors pay for this. We've had people that work the counter at 7-Eleven gas stations. They work as a gas station attendant. They don't own the gas station. They just work there. We've had students pay for it. We've had people save. I had a patient who saved money for 10 years to come here and pay for their surgery. So we have a lot of people that are poor that pay for this surgery because they believe in it. And you should too. Now, do we have rich people? Yes, we have billionaires that come here as well. I can't give you their names, but they come here. They're billionaires, they're hedge fund managers, there are bankers, people who own banks. I mean, I can't give you details, but we have very wealthy people that come as well. But the vast majority of the people coming here for this surgery, they're not wealthy. They just put their health ahead of money. You see, they realize that the most important thing in life is not money, it's your health. And so they're willing to pay out of their own pocket, out of their savings. They even mortgage their house to pay for this surgery, okay? And yeah, we're almost done. I got a minute left. That's fine though. For me, I used to feel horrible for these people to have to do that, but then I realized that if they didn't, we wouldn't be here. We would be gone and we wouldn't be available for anybody. So yes, it's terrible that people should have to pay out of pocket, but it's better that they make this a priority and pay out of pocket than we're not here to serve people. So I think it's more important to be here and do the surgery, okay? People can do great things when they work together. It's very hard for one person to fix a system. But when people work together and help each other and they work for a common cause, great things can happen. That's how this nation was built. The greatest things that happen in life don't happen from one person. They happen from people working together that share a belief in something and want to see a result that they all want. Does that make sense? That's what makes success in life. All right, we're done. There's the nerve right there. You guys see the nerve? Oh yeah, it's beautiful. I'm going to actually bring the grabber to show you. This is the L5 nerve root in the foramen on the left side. It's been decompressed now, but just take a look at this thing. It's beautiful. We got a great see of it, great look of it. It's right there. It's literally right there, that fat thing from 12 until 9. That's the nerve. And the nerve is not being pinched anymore. You can see it's decompressed. I do want one more laser at right there. See if I can get a little bit more of that stuff. That's more bone spur than anything. Bone spur is harder to get to, but we do have a powerful laser that can remove it. Laser on. Thank you. Any other questions?
Yes, we have about 2 questions. This next one is coming from Smarzig, once more on YouTube.
All right, that's all I can do.
Asking, I was misdiagnosed with Piro syndrome for years, which wound up being herniated my L3-S1. After pain management, doctor told me the Piro syndrome is overdiagnosed. Continued, and he confirmed with an MRI. I believe this Smarzig is asking for advice here.
Smarzig, the best advice I can give you, put your MRI on our website, MRI review, and do a Zoom call with me. Okay? Get a real diagnosis. Get the real diagnosis about what's wrong and how to fix it. That would be my advice to you. Any other questions? I think we have one more.
Lastly, coming from J Rock on YouTube.
J Rock, I love it.
Could that pain be CRPS from that herniated disc?
No. CRPS is complex regional pain syndrome. It is what used to be reflex sympathetic dystrophy. Complex regional pain syndrome is different. It's usually pain in the joints and trauma to the joints from nerve damage that's from the herniated disc, for example, that causes it. We rarely see it. And more importantly, by the way, CRPS is not curable. We cure people's pain. So that's another reason why we know it's not CRPS. You can't do surgery and cure CRPS. We do surgery and cure their pain. All right, there's the incision. It's 7 millimeters. We did one on the left, one on the right. Everybody did a great job today. Thank you, Dr. Berndes, for getting it right. I love it. Thank you. All right, thanks for joining us. Scope use is a 7. And I'll see you all next week.